Thank you very, thank you very much, James. It's my pleasure to be with you and sharing some thoughts about the tragic situation that we really are living in Brazil. I will share my screen so you can follow my slides, and
We can see them.
you can see it. Good. Yes. So that's the title, Evolution of COVID-19 Pandemic in Brazil, and an examination of different levels of response. That's the number of today. We reached 13 million cases of COVID, 300,000 deaths accumulated since the beginning, since March 2020, and currently more than 1 million infected patients, most of them in mild conditions, but significant proportion, 0.7% in serious or critical. That's leading our health system to a collapse. We have a waiting list for ICU beds of around 4,000 people all over the country. Comparing internationally, we are second for a while, second only to USA. You can see we have in cases per million population, we are 60,000, 61 million people for cases for 1 million people. And you see the number, the proportion of deaths is much closer to the USA numbers. One, one, 1,000 and a half cases for 1 million population Brazil. Chile, a country, a neighbor country, has a much better situation. You see, even numbers of cases, but much better in numbers, in proportion of deaths. 491 deaths in Chile for 1 million population. China is completely out of the cure. You see, only 3 deaths by 1 million population, only 63 cases by 1 million persons. But Australia and Vietnam also are doing very well. You can see the numbers of cases and deaths by 1 million population in these countries. So something very different is happening or was happening in USA and in Brazil. But now you can see in the figure at the right side of the slides, the daily trends in number of COVID-19 in case in US. US are getting better. You see in the end, March, April of this year, the number of cases has dropped down. It's not the case in Brazil that still in April, 6th of April, we have almost 87,000 cases in one day only, and in a trending, an increasing trend of number of cases. So if there is hope in the US, there is no hope in Brazil for the near future. You see here the number, the daily trends in number of deaths in Brazil and the US. It's a up trends, the trend is increasing trend in Brazil and a declining trend in the US, number of cases. We had yesterday, you had 4,000, more than 4,000 deaths, almost 4,200 deaths one day. How could we reach this situation? I think, not only me, but a lot of people think that the main responsible for the situation is the president, is his behaviors, his speech. And that's not only an impression or how can I say, what we think. It's not a matter of opinion, but people are studying this. And during last year, the federal government issued 3,000, more than 3,000 decrees relating to COVID. And analyzing all these acts of government, it's clearly that they attempt to resist response from other branches of government, other federative entities, independent institutions, and even society. These decrees, these acts of government, try to obstruct the response of the state and municipal governments, and also advertise, extend public health. The political discourse that mobilize economic, ideological, and moral arguments, fake news, and technical information without scientific proof. Bolsonaro has been promoting the use of chloroquine, a very good medicine for malaria, but with very adverse effects to COVID patients. He speaks all the time against vaccines, that vaccines can make people worse, against the use of masks, of facial masks, all that he can to discredit health authorities. Are you listening to me?
Yes, we can hear you okay.
Okay. I had a message here in my computer. Sorry.
Hmm.
Weakening popular adherence to health recommendations based on scientific evidence and promoting political activism against the public health measures necessary to curb the COVID's advance. Just to give you an idea, selected statements by the president. You can see we have a small crisis. It's a fantasy. It's the media, the great media that spreads fake news. When asked about the high increasing number of deaths in April of 2020, he said, "Well, and I have nothing to do with it. I'm sorry. I can do nothing. I have Messiah in my name. I'm Jair Messias Bolsonaro, but I don't make miracles. Death, disability, anomaly, this is the vaccine that can cause." And at December last year, 3, 4 months from now, he said the pandemic is really coming to the end. The Ministry of Health would be the federal authority to coordinate the actions to control the pandemic, had a first minister from his government fired on April when the number of cases began to peak. A second minister of health less than 1 month was fired on May. They were doctors that wanted to implement the actions, the recommended actions by WHO and by all what science would say. So he had a third minister, a military man without any training in health, but quite obedient, that did everything as the president wanted him to do. And now recently, this last month of March, he was fired in the middle of a negotiation with the supporting parties, political parties at the National Congress. And now we have a fourth minister that's a cardiologist, but that when he took office, he said that the health policy is not the ministers, but the presidents. So he continues to be very obedient to these orientations. But of course, the other branch of government has trying to resist. In March 2020, the National Congress declared the state of public calamity in Brazil, allowing to use the budget and to increase actions in the health system. So the health budget had an increase of 30% last year. Although no increase in 2021, this year, our health budget went back to the values of 2019. What's a big problem we have now? The National Congress approved a financial aid, an emergency financial aid for unemployed and informal workers. It was in place during from April to December 2020, a small amount of around $120 US dollars per month, but reached 60 million people. So it was important not only for the people and family who received it, but also for making the economy walks and move. And it ended in December, and it's now beginning again. So January, February, March, no financial aid for nobody, and now it's beginning for 3 months, but as a smaller amount of money, just $30 per month, and we reach much less people, only 14 million people. The National Congress also approved the credit for small and medium-sized business, but in practical terms, the bureaucratic requirements prevented the credits from being used. So a lot of small and medium-sized businesses were closed. Autonomy of the states and municipalities were stated by the Supreme Court. The federal government wanted to impose many rules to the states and municipalities, but he couldn't. The president, he couldn't. And also the Supreme Court forced the federal government to make a plan to care for indigenous people who were one of the most hit groups of the population. What we actually had in terms of actions to tackle the COVID pandemic was the actions of the state and local authorities. We had a really important expansion of hospital beds, especially from ICU beds, stay-home orders from governors and mayors, information campaigns related to the use of masks, hand washing, and social distance, and also the vaccination, which began in January. For this program of vaccination, we have a target population, considering the priority groups of 77 million people, one third, a little more than one third of the Brazilian population. But until now, only 33%, it is 18 million people, got their first dose, and only 7% of people of these priority groups got their second dose of the vaccine. The social distance reached a peak in March 2020 of 62% of the population who used to work at home, stay at home, but now it's much lower, in 38% of people keeping social distance. Here you can see we have important expansion of ICU beds by region, comparing February 2020 and January 2021. You see in the 5 regions of the country, the Southeast region is the richest country, has the most part of beds are concentrated in the Southeast region, but we see a relative bigger increase in the north and northeast regions that were regions with less beds, less ICU beds. So it was an important that prevented a lot of deaths, certainly. We had important impact on poverty. It's estimated that 17, almost 18 million people returned to poverty between August 2020 and February 2021, from 9.5 million to 20.2 million in February. We now have 13% of the Brazilian population in poverty. These people are surviving. Poverty is very, very poor. They are surviving on a per capita income of just around $50 US per month. And that picture shows the main characteristic of my country, of our country, that is inequalities. You see side by side a building, a very beautiful, with swimming pools in each apartment, and at the side a favela, a slum in the city of São Paulo. But we had also response from civil society. The Front for Life, a group of several entities from health professionals, from academics, from scientists, wrote a national plan to combat the COVID pandemic since April and May of 2020. The main strategy of this plan is the concerted action of primary health care and epidemiological surveillance, with an active search for confirmed or suspected cases and blocking of transmission, measures for qualification of specialized and hospital care, strategies to mitigate economic damage, supporting financially small companies and vulnerable populations. This plan was presented for several state governors, for the National Congress, and even to the Minister of Health when I was the second minister. The Front of Life, this group of several organizations from civil society, are now united around this program. First item, the strengthening of the unified health system, our national health system, and requiring the budget recompositions. We're trying to get vaccines for all, but provided by the SUS for our national health system. Yesterday, the National Congress has approved a law allowing private people, private company, private institutes to buy vaccines and use it in their own people, for the people who can pay for it. So instead of a vaccination plan made according to the ethical and epidemiological criteria, we will have an apartheid, a vaccination apartheid. People who can pay will have the vaccine, and people who cannot pay will have to wait a long time for a vaccine. We are also struggling for the return of the emergency financial aid of $120 while the pandemic lasts. And immediately, we're struggling for a lockdown in April for at least 21 days. You are in a rising numbers of cases, rising numbers of deaths, and so we have to go to lockdown to stop the transmission of the virus. But it's impossible to have a lockdown if people have to go outside, to go out to look for money to buy the meal, the daily meal. And for at last, also the impeachment of Bolsonaro is part of our menu of measures to tackle the COVID. There is at least 70 process in the National Congress asking for the impeachment of Bolsonaro, but he has now the majority, still important support of the National Congress. He managed to change the presidents of the National Congress and to have an alliance now in this post. And it's up to the president of the Congress to decide if the impeachment goes on or not. I think that's the idea I'd like to give you for the situation in Brazil. And I'm available if you would like to make some comments or questions, would be welcome. Thank you very much.
Thank you so much, Luis Eugenio. This is really, really insightful, and it really gives us a context of what's going on in Brazil. And I think the really interesting and important component of civil society, right? We don't see the same kind of sort of coming together, developing a plan, and really engaging in all the public health activities as well as the advocacy and everything else. So I think that's really something unique, and it's, as we know, a great strength of the public health infrastructure in Brazil. So why don't we open it up for some questions? I've scanned everyone, looks to be real people, so we'll allow you to speak. If you want to speak, if you want to put a question into the chat, I'm happy to read them to Dr. de Souza also.
Hi, it's a pleasure being able to hear all this brilliant presentation. Thank you so much for putting this together. I'm sure it wasn't easy, and thank you again for accommodating through the roughness of the previous meeting, which was also, it took a lot of resilience. And in that term, I wanted to get to, I particularly have a firsthand vision of how Brazil is. I used to be a family physician in the public system, and in São Paulo, in one of the slums, in the primary care underserved areas. And what beats me to see how the country is responding is, back then when we were working with public health, we had the best vaccination, we had the best responses to any outcome. Like, if a child is not gaining weight, we can point out to exactly what's happening. Like, we have that much of a Zoom perspective, and I know every public health worker in Brazil has that same perspective. I'm just failing to see how, independent from the government, which is obviously what has been stopping us for now, was there anything else that could have been done? And if so, can we still look forward to that, in the sense of pushing our health system into doing what it was designed to do, and maybe getting help from the best we have, which are the workers and the staff and the system that's already in place? And I wish that was enough. Like, if that could be a way out of this, without, of course, mentioning the other part, which is required but takes longer.
Thank you.
May I comment on that?
Please.
Yeah. Actually, we had a very good national program for immunization, but we have the biggest problem now is the lack of doses. We had the opportunity to make agreements with the industry and buy more doses, but the Ministry of Health didn't made any action to buy, to make agreements, and to make deals with the industry. And we had only, for the initiative of the state, the governor of the state of São Paulo, to have the CoronaVac, an agreement with China, with industry from China, to have a vaccine produced in São Paulo. And also an agreement by Fiocruz, that a National Health Institute, with the Oxford AstraZeneca, to produce here the dose of the vaccines, but it's a small number of those. So our vaccination goes very, very, very slowly. We had the option. Now the Supreme Court allowed the states to buy directly from the international companies more doses, but it's still on the way. The second point that actually had also a very important primary health care system in Brazil with very good results, but it has been under attack for a couple of years right now. So we had a reduction in the coverage of the health family strategy. We lose a lot of doctors. We had an agreement of Cuba for doctors, so it was finished when this new government took office. And also we had changes in the funding of the primary health care, that in real terms we had a reduction of the budget. And also we had, during the pandemic, all the resources from the states and municipalities went to hospitals, to the expansions of beds. We had not even from governments, from state governments, we had no money for the primary health care. So that was a mistake, clearly, because the actions of early identification of cases, to make isolation and quarantine, all these measures that could be led by the professionals at the first level, at the primary healthcare level, were not made. So in the beginning of the pandemic, all the primary healthcare units were closed. We didn't know how to do so. That so we had a big expansion in terms of hospital beds, but a reduction in the coverage of the primary health care. So even the strongest points of our national health system were weakened during this period. So now we are in a very difficult situation because after a year, 2020, where there were more money for the national health system, now in 2021, there is less money. And you know, the federal government can create money, can create credit, but not the state governments, not the municipal governments. And also with the reductions of the economic production, the tax that the states collect went down, important reductions. So we have a big problem because the states, they cannot make debt. They are not allowed they do not have the power to make money. So they depend on the federal government. And now the federal government has reduced just to give you an idea, until now, we have not the official budget, federal budget approved. Even the federal level can have no money. They are using just part of the budget of the last year because it was not it's not still in place. So it's very, very difficult situation, actually.
Thank you. We've got a couple questions in the chat. I know that Cindy, you received one, and I've also got one after that.
Great, thanks. And the question is from Sierra. It says, thank you so much, Dr. De Souza. Do you think the high amount of deaths per cases is due mostly to low-income people not having access to quality hospital care or background factors like undernutrition?
There is a lack of care. I mentioned the waiting list, but there is also a lack of quality. We have a fatality rate, a very high fatality rate in hospital. If you go to ICU and you have a ventilatory support, 80% of these people die. So it's a very high number, because the more difficult issue when to expand the health service, the hospital service, is the professional. So now we have untrained doctors that working in ICU units, in units of intensive care. So we have a problem of quality. We should have had training for these doctors, but no training actually were made due to the emergency. But of course, also we see the most of people who die are elderly people and with comorbidities. So have hypertension, diabetes. So, but what's most sad, maybe saddest now, is that in the second wave recently, even more younger people are dying. Younger people are dying because the new variant that came from Manaus, from the Amazon, seems to be not only more contagious, but also more deadly. So I think all these factors, lack of access, lack of quality, new variants, and also the comorbidities have been everything have been involved in this in the high number of deaths.
Thank you. I think one of the interesting things that you brought up was, in the absence of a strong federal response or an appropriate federal response, that local government and civil society kind of stepped in. Can you comment a little bit more about, how is it that the local Brazilian civil society organizations were able to really come together to kind of have a cohesive, alternative plan to deal with COVID?
We have a very strong civil society. Even the creation of the national health system, the unified health systems, is a consequence of the political struggle for democracy in the 80s, in the last century. And now we have these plans. It's a very, very good, technically very good plan made by scientists, academics, and health professionals that were voluntarily working to write this plan and to diffuse, to disseminate this idea. So we have an increased number of blogs and in the social media, very active persons and groups, and trying to diffuse this idea and to pressure the federal government. It's important to say that the financial aid, for example, was the federal government didn't want to make it, to pay for it. They were obligated by the civil society that made pressures over the National Congress. So the financial aid was can I say, was a civil society success of the struggle. So even to the vaccinations, we had no vaccination if you were not, if the government were not under pressure from the society. Bolsonaro clearly didn't want to any vaccine. So if you have if you don't have the state of São Paulo and also Fiocruz and the civil society supporting them, we wouldn't have this vaccine. But also we have very important initiatives, very local initiatives. The picture I showed you from the favela and the slums, it's called Paraisópolis in São Paulo. They are kind of, how can I say it, self-organized community. So they built a system of ambulance, a system of self-help, to help themselves. The community, they are organizing themselves to give healthcare, but also to support the children, to support the family who have anything to eat. So there is also a kind of solidarity very strong in these poor communities that are developed. But of course, everything is not enough to tackle the progress of the pandemic. Very recently, we had a hope because we have Bolsonaro still have some support. The support comes from two main groups. The first is the military men, that the army they have many privileges during these years. They had high incomes. They have they are protected from paying taxes. So they gathered the military, especially the how can I say, the low hierarchy from the military men. So they have this support. And the second support is the new church, the evangelical the
Pentecostal.
Pentecostal church, the electronic Pentecostal church that supports them with money also, with money but we had an important new, the military, they had a split, the army. So part of the general, they are not supporting anymore Bolsonaro, but they have this support. And also the economic program of the federal government, that's a neoliberal program of privatization, reduction of the size of the state, investments of public investments in the economy. This kind of program has the support of the richest groups of the population, of the wealthy people of Brazil. Only very recently, bankers and big businessmen they are beginning to be worried about the situation. But you see, they are trying to buy vaccines for themselves. So we have an elite and a group of the most powerful people that are really supporting and still supporting Bolsonaro.
Thank you. Yeah, for sure. The political economy really comes into play in such, a devastating kind of way. The divisions that are already within the country are kind of playing out, as the epidemic progresses. Do we have some other questions for Dr. De Souza?
I had one observation, perhaps not a question. But I think the situation in Brazil actually is analogous to the situation in the United States. We suffered through 4 years of very bad leadership. But in the end, we were able to replace that leadership because in the end, it's the electorate that votes the president in, and it was the majority that voted the bad president in the first place. We were able to turn that around. So my question is, in Brazil, is your electorate susceptible to recognizing the need to change leadership to confront the pandemic?
Next year, we're going to have elections. Currently, Bolsonaro is not very well positioned for a re-election. But also, we don't have another leader clearly stated. Lula, the ex-president Lula from the Workers' Party is a strong candidate, but he has only 30% of the votes. So he would need to make alliances, and it's not easy for him to get these alliances. So it's a very unstable situation. You cannot predict any result. It's not probable a re-election of Bolsonaro, but it's not impossible. It depends a lot from the as I mentioned, the most important people, the richest people, the wealth people, because we have a media monopoly oligopoly, 2 or 3 big media. You have a lot of money that goes into the election. So actually, we had a society that's power is very concentrated into in the hands of the richest people. So you know, it's not to have elections is not a guarantee that you are going to change. It will be an opportunity, but you would have to have an option to vote for. It didn't show up until now.
Wonderful.
Thank
I know
you.
we're running a little bit late and many people have had to log off. But I know we also started late. So I'd love to give it, if there's another burning question out there while we still have Dr. De Souza on the line. Why don't we just try for one more?
Yeah, if you don't mind, I'd just like to ask a question on the vaccine. Like Dr. De Souza was saying right now, there is a big private, like you said, I think you said the government is incentivizing private companies to buy their own vaccine. I don't understand that. I would definitely see that happening here in the US. I don't see how that works in a system where it's all centralized and unified as in Brazil. I'm just wondering, is that an initiative? Is just gossip? Is it really going to be used? What are they working towards that? And rather, could they use that money instead? Because there's a short supply of vaccinations and vaccine supply, and the entire chain in Brazil, for what I've seen, like from manufacturing to distribution to the actual implementation. I think we're pretty good, like you said previously. We have a very good system, but the previous steps are the ones lacking. And could that money be used towards actual solutions in terms of vaccination in the larger scale, if at all used in this sense? Thank you.
Thank you, Dr. Ramia. Yesterday, the National Congress approved a law allowing any private corporation or institution to buy vaccines from the industry. Of course, they will be not easy to buy because there is a shortage of doses all over the world, but they are by law allowed to buy it, to apply, to use these vaccines, the dose of vaccines in their employees, in their families. They have to give 50%, half of what they buy to the national health system, to the SUS. But the other half they can use as they want. And more, this money that they will use to buy vaccines for themselves, they can, at the end of the year, reduce the tax they have to pay, the personal tax. So I have spent money with vaccines, so I will pay less tax in the end. So at the end, it would be the country, the public, who are going to pay for the rich people to have vaccine first. It's not only an ethical problem, it's a big ethical problem, but also is an epidemiological problem, because it will be harder to control the pandemic if you don't vaccine the people who need it more, the health professionals, the people who are in the front of line of tackling vaccine. They were going to protect people who are not in the most risk. So that's a problem, but that's not gossip. That was approved with the support of the government and of the support of our elites, our richest, the wealthiest people in the country. It's what we call the necropolitics, the politics of death. That's what's going on, unfortunately.
Well, thank you so very much for this really sobering update on current events, and really from an insider's perspective, and as someone who's really advocating for these alternative approaches and really putting political pressure as a health researcher, as a health activist. We really appreciate all of the incredible work that you've been doing. So with that, I'd like to thank you. I'd like to thank our participants also for being, again, as Dr. Ramya mentioned, so resilient to come back into the second link after we got bombed on the first link. So thank you, everybody. And we look forward to maybe 6 months from now, we can invite you back, maybe if there's a hopefully positive developments in this ongoing crisis. Thank you so much.
Thank you very much.
Thank you.